Hello, everyone. Jonathan Edelheit, CEO of the Medical Tourism Association. Good morning, good evening, good afternoon, depending on where you are in the world. I'm excited for today's presentation, Healthcare Reform's Effects on Medical Tourism, the Reality and Practicality, our webcasted white paper. I think this is a very fascinating topic, and I think it's important. And what we're going to kind of go over today is really explaining healthcare costs in the U.S., healthcare reform, and then what is the real effect on medical tourism. And I think this is important because everywhere I travel in the world, people don't understand what healthcare reform is. They don't understand what it really means. Is it free care? Is it more affordable? Does it mean free surgeries? Does it mean people don't have to pay for health insurance? Does it just mean they don't have to pay for the actual hospitalization? Are there going to be more insured, more uninsured? And is this going to be positive for medical tourism, neutral? Is it going to be negative? And unfortunately, there's also a lot of misinformation out there. People trying to say, telling people, oh, this is going to be very negative, and here's the impact, when it's not really based upon any fact. And it's understandable that people around the world don't understand what healthcare reform means in the U.S., because even in the United States here, the majority of Americans don't understand what it means and don't know the effects of medical tourism. So the Medical Tourism Law is called the Patient Protection and Affordable Care Act, which is PPACA, but they really kind of changed it, and they stopped using the patient protection part, and now it's commonly just referred to as the ACA, the Affordable Care Act. So today we're going to cover, what does the Affordable Care Act really mean? Are costs going to go down and be more affordable, or are they going to be more expensive? Doing some case examples, and then also going into health insurance exchanges, the state exchanges in the marketplaces. And to give you some background, outside of the Medical Tourism Association, I'm very active in healthcare reform, and I doing a lot of healthcare reform training and certification around the country for employers and agents, doing it online. I do a lot of speaking on it. And, we're doing training all over the country with health insurance agents and partnering with local associations. And we work, and I personally work with a lot of the top national leaders in healthcare reform, from that are the national practice leaders of the top law firms. So we're doing, outside of the medical tourism side, I'm doing a lot of education on an ongoing basis to the U.S. insurance marketplace as to what's really happening with healthcare reform and where it's going. So you're really going to get a good insight into the reality of healthcare reform, not what you hear in the news and media. If you're trying to get information regarding healthcare reform, do not watch the news, whether it's Fox News, CNN, MSNBC, BBC. You're just not going to get anything accurate about what it really means. The law has not really changed in 3 years, in 2010 when it passed. But unfortunately, a lot of the information about what it really means has not passed down to the public through the media. So first, I want to go through a couple slides on healthcare costs in the U.S. And also, before I do that, is, as I said, there's a white paper. We have over 30-page white paper. As a participant of the webcast, if you email us, we'll send you a complimentary copy of the white paper. Otherwise, it's for sale for $99 for people who are not on the webcast. It's also free for MTA members, and that really is going to put everything into into paper, what we're kind of going over today. So if we look at back in 2009, one of the last reports was run by the OECD, and how much per capita is spent on healthcare expenditures. Obviously, at the bottom is the United States in blue, and it's almost double that of most other countries. And in some of the other developed countries, it's 3 times as much. And I think this is a common fact. It's known that healthcare costs are the most expensive in the U.S. But I want to go back and look at some slides as to where it came from in the past and where it is today. So if we look between 1960 and 2010, you'll see a massive change in healthcare costs. In 1960, it was $147. And then 2010, we're talking about $8,402 per person. That's a massive change. So we can see that the costs just constantly go up significantly, and they're not leveling off. They're not going down. They consistently are going up. If we look at some statistics on Americans, Kaiser, which is a really great source for anything regarding health insurance or healthcare in the United States, Kaiser Family Foundation. They put out a bunch of surveys this past summer, just a couple weeks ago, and this one was done actually. It looks like August 2011. But with this study, they found that a lot of Americans are putting off healthcare because of cost. So if we looked at some of these, 31% skipping dental care because of cost. 28% putting off or postponing getting health care, because of the cost. So it's a large portion of Americans that are putting stuff off because of cost. Now, we look at increases in health insurance premiums and workers' contributions to premiums. So this is employer-sponsored health care and benefits. You'll see that starting in 2000, there is a significant increase in the amount that an employee has to contribute towards their health insurance premium in the workplace, even though their employer is paying for most of it. So you're seeing we look from the 2000 to 2010, a very significant, it went up 147% in those 10 years from 2000 to 2010. So it's going up for the employers, it's going up for the employees and the individuals. If we look here at this chart, which is the worker contribution versus the employer contribution from 1999 to 2011, with the worker contribution being in orange, you'll see it went from $1,543 in 1999 to 2011, $4,129. And then from the employer's part, what the employer has to pay, it went from $4,247 in 1999 to $10,944 in 2011. So really significant increase in just the past 10 years. So just imagine what those numbers are going to be by 2020, because we're continuing on a similar trend. So we look at this chart, I find really fascinating, because we're looking at what is the prevalence of high out-of-pocket costs because of chronic conditions for the non-elderly, and it compares 2001, 2006, 2008. So if we look at one chronic condition, it went from, in 2001, 12%, to 2006, 17%, 2008, 16%. So what that's saying is there's not that big of a variation on chronic conditions. And what I mean by that is they're not getting really worse or better. There's no significant change. So why that's important is it's showing that costs are not going up in the U.S. because there's more chronic conditions or more of a prevalence. Because if we look at people with 3 or more chronic conditions, in 2001 it's 27%, in 2006 it was 32%, and in 2008 27%. So the same amount of people with 3 or more chronic conditions in 2008 and 2001, but the costs have almost doubled for what employees are contributing, what employers are contributing, and the actual cost for those health insurance premiums and healthcare costs. So that's just showing it's not the chronic conditions, it's the healthcare costs that are going up. So, another chart is this is about how young adults want and value health insurance, but they worry about paying for medical care. So this webcast will be available for you later, so you really delve into a lot of these slides and look at it for information. This was just done in June of 2013. So in about 24, 48 hours, we'll make it available with the video and the PowerPoint together. Uninsured cite cost as the most common reason for being without coverage, 40% saying it's too expensive. So, there's a large amount of people that would want care if they could actually afford it. There's a very big mixed opinion on the Affordable Care Act, ACA. This is from Kaiser from just a couple months ago, and it's showing that, there's still more people view it negatively than positively. But it's almost an even mix, meaning like half the people think it's good, half the people think it's negative. But the interesting thing is nobody really knows what it means. So they haven't really seen the true effects of healthcare reform. Obviously, what they're seeing right now is we have a government shutdown over healthcare reform. But it's a lot of political posturing. So people really haven't seen the effect of it. But some people are starting to see some of the effects. And when people really see how it affects them, whether their costs go up and down, they have to pay more, whether their coverage is better or worse, that's when we're going to see the real true public opinion hit. Right now, this is just what people assume. the law is. So when asked if more people think the country is worse off under the ACA than better, it was very interesting to look at the statistics on that. You'll see that 40% feel that it's worse off, where 31% feel it's better off. Really great story. I think one of the best pieces that I've seen really covering medical tourism in the U.S. The Medical Tourism Association work with Diane Sawyer Show. She's one of the top broadcasters here in the United States and one of the most respected. We work with her production team, ABC News and Nightline, to put together a piece of the first U.S. employer who was willing to go on record publicly and talk about how they implemented medical tourism. And this is really important because the employers and the insurance companies who are doing it, they're not out publicly saying that they're doing it. They're doing it very quietly because no one wanted to be that first story and no one wanted to deal with any possible political repercussion. So we had two members, an employer member, a hospital member, who both agreed to allow the story to be covered, and it was was just on Nightline and Diane Sawyer's show this week. And the link is on this webcast, and you can also click the video when you get the PowerPoint to watch it. But I think it's a great piece, and it's the story of I'll go into it a little later, but a North Carolina manufacturing company who sent 250 employees overseas over the last 5 years to India and to Costa Rica and save $5 million. So this is going to be have a very big impact on the medical tourism industry in the U.S. because it's going to give more confidence in other employers and insurers publicly saying, yes, we're doing it too. And then everyone else who's sitting on the sideline, the other employers and insurers are going to see this and say, hey, we need to do this. It works. This is a case study that we can kind of go off of, and because there hasn't been an employer that's gone public about it before, there's no case study or best practice for employers to really look at. So to really look at how healthcare reform affects employers, and by the way, on that piece on Nightline, one of the reasons the employer cited is that they believe that more employers are going to do this because of healthcare reform and costs going up. And the reporter on Nightline covered a very important fact, and that is that the healthcare reform law does not in any way prohibit medical tourism, meaning employers, insurers can offer medical tourism, and people can travel overseas. So some employer examples of what's going on with healthcare reform is just a couple months ago, the UPS, United Parcel Service, a very large employer who does a lot of the shipping of packages here in the U.S., decided to drop health benefits for 15,000 employee spouses because of costs. So they specifically cited the Obamacare. The University of Virginia claimed the ACA is going to add $7.3 million to the cost of its health plan, so they're no longer going to offer spousal coverage to employees whose wives or husbands have access to health insurance elsewhere. And Delta Airlines said the healthcare reform law is going to increase their costs in 2014 by $100 million. And Delta submitted a letter to the government basically explaining this in their position. So you can kind of read this later, but it goes into the bullets of all the different areas where it thinks that the healthcare reform law is going to increase their costs. Now, can you imagine? The healthcare reform law is almost 1,000 pages. There's over 30,000 pages of rules and regulations so far, and it hasn't even really gotten started. There's between 159 to 180 intergovernmental agencies, committees, bureaus, commissions, boards that are all involved with providing the rules, regulations, and interpretation and enforcement of the law. So a tremendous amount of bureaucracy. So what's really the expected effect on medical tourism? Healthcare costs are going to increase, and we've already started to see that. More U.S. insurance companies and employers will implement medical tourism as a cost savings approach because of increased costs of health insurance. And I think you'll see that just in the case of HSM, the employer who saved about $5 million over the past 10 years. I'm sorry, not 10 years, but saved $10 million over the past 5 years sending 250 employees overseas, more employers are going to do this to save money. Longer waiting times if there's more insured patients and there's doctor shortages. And more hospitals are going to pull out of Medicare because of smaller reimbursement, which is going to make it more difficult to receive care in the hospital. So what are some of the healthcare reform positives? Because part of this presentation is we're not really coming in and taking a side and saying, we're pro-healthcare reform, we're against healthcare reform, we're siding with the Republicans, we're siding with the Democrats. This is really kind of an agnostic approach to really explaining healthcare reform. So some of the positives, waiving of pre-existing condition clauses, very positive. If you had a health condition before, some insurance companies would deny you coverage. They would not provide coverage for you because they said you had a pre-existing condition. So now you're guaranteed to have coverage. They eliminated annual and lifetime limits. This is really positive too. So you might have had a $1 million lifetime limit with your health insurance plan, meaning that if your medical claims ever reach the million, you don't get coverage anymore for the rest of your life if you're with that insurance company. And that was eliminated. So now if you can have claims of $10 million, $15 million, and those are rare cases, but you have unlimited amount of claims. But obviously, if you waive pre-existing conditions, if you eliminate annual and lifetime limits, if you make health insurance guarantee issue so anybody can get it, guaranteed to get it, there's a repercussion to that. It's not more affordable, it's going to become more expensive. It's just like buying a car or buying a home. If you're buying the base model, you're going to pay less than if you're buying the more comprehensive one that has all the upgrades. So it's simple common sense and economics. You can't give increased benefits without increasing costs. So the law was marketed to the American public as making healthcare more affordable, but in reality, we're going to go over in a couple slides how it actually doesn't make care more affordable. It will make it more expensive. And before healthcare reform is passed, if you extrapolate inflation with healthcare on a very high end, there's low end estimates, mid-level estimates, and high end, you'll see that individual health insurance could cost as much as $14,000 for an individual or $40,000, close to $40,000 for a family by 2020. So obviously these are not sustainable, and Americans will not be able to afford them in the future. So what does healthcare reform really do? It didn't create a public government plan. It's still a private industry. It created health insurance exchanges, which are now being called marketplaces, where people can go online and shop for insurance through multiple insurance companies. So we're going to kind of go into the exchanges and give some examples, but there's been a lot of problems with these exchanges. They just went into effect October 1st. Some of them are not working. Some of them they're kind of overloaded, with users trying to check it out. And we're seeing a lot of on the Republican side, a lot of criticism of the health insurance exchanges because they're saying it's not working. I really feel to kind of take a middle ground, we really need to see and give them a chance. They just went live October 1st. It was the first time this has ever happened in the United States. Obviously, there's going to be technical problems. I think, President Obama just said yesterday on the news that he equated the problems with the exchanges with Apple's last upgrade. So obviously, there were some technical issues with Apple's last upgrade, and you think Apple's going to do everything perfectly from a technology standpoint, but they didn't. And people could get into your your Apple phones, your iPhones, without having to know your actual passcode to get in it. So he kind of equated to that and said, nothing's perfect. Give it some time. Also, the healthcare reform law mandated that all Americans purchase health insurance or pay a fine, and the fines mandate start in 2014 if only $95. They're starting in 2016, where if you don't have health insurance, it goes up to $695, or 3.5% of income, whichever is greater. So the fine to not buy insurance is very, very small. $95 a month is, it's like $8.50 a month. So if you're told that you have to buy health insurance and it's $500 to $600 a month, or you can just pay a $9 fine per month and not buy insurance, and then when you really need it, buy it, and it's guarantee issue with no pre-existing condition, people are just going to wait to buy insurance. There's no incentive to buy it. That $10 a month is nothing. And then if you're talking about if you have a family, you could be talking about $1,000, $1,500, $2,000 a month for your coverage. So this is one of the major flaws of the law, is the fines don't really encourage people to buy health insurance. So by 2014, insurers may no longer charge individuals and small businesses higher premiums or deny coverage on the basis of pre-existing conditions. So this is the waiving of the pre-existing condition clause, and more importantly, it's saying we're creating a new fair system where healthy and sick people pay the same cost. So if we take a step back and really think about it and say, healthy people pay this price and sick people pay the same price, what does that mean? That means that healthy people, their costs have to go up. So if sick people's costs are up here and healthy are down here, it means sick people's costs come down, healthy people's costs come up, so they can meet in the middle. So the healthy people pay more and sick people pay less. So that's great for sick people, but it's not good for healthy people. And that might drive healthy people to opt out and not buy the insurance and then wait until they're sick and they really need it. And then what does that do? So if these healthy people drop off and there's less, it means the cost for the sick people go up and the cost for the healthy people who decided to stay with insurance also went up. So it's obviously positive, the PREACT, the waiving of health insurance, but it needs to be tied to an individual mandate and fine that is expensive and therefore forces everyone to buy insurance. So if we really look at the drawback of having something where you have no pre-existing condition clause, it's a guarantee issue, and it is, and there is, everyone pays the same cost whether you're sick or healthy. To give you an example is, imagine you have two drivers of cars. One is a horrible driver getting into accidents all the time, and one is a safe driver. So one speeds, drinks and drives and gets into accidents. One goes the speed limit, never does anything illegal, and always drives safe. It's saying they now have to pay the same price. So the safe driver's price goes up, the bad driver's price go down, and now let's create a fair system. Some other things with the law, the senior citizen, older Americans' costs are going to go down. So older Americans are supposed to be paying 5 to 1 or 6 times to 1, so that means 5 to 6 times the rate as a younger person. So that's an actuarial analysis with health insurance that says they consume more health insurance, they use it more, so their cost should be 5 to 6 times that of a young person. So healthcare reform artificially changes that to say, no, it can only be 3 times the rate of a younger person. So what does that mean again? Older people, their rates come down, younger people, costs go up. So now imagine if you're younger and you're healthy, and then you've got an older person who's sick, it means you're getting hit kind of twice with your costs going up as a younger person. Rates can't magically come down. You can't just say older people now pay 3 times the cost of younger people when they're always paying 5 to 6 times. Someone has to pay for it. And the challenge with that is raising younger people's costs even more is a problem because it's already difficult to get young people to buy health insurance because they feel that they're invincible and they're healthy and they don't need it. And with health insurance, you need younger people in the insurance pool. So you have adverse selection. You have a good selection of risk. So other healthcare reform elements that drive costs up, dependents. Younger adults now are allowed to stay on their parents' plan to age 26. That was positive, but it costs something. It's not free. Also, insurance companies, they have to spend no less than 85% of health insurance premiums on medical costs in the group market and 20% in the individual market. So it's saying insurance companies, you can only make 15% profit in the group, 20% in the individual for your profit and your administration. So one of the things that healthcare reform really was health insurance reform, dictating how much money the insurance companies would make. But one thing that was really never covered on the news is if you look at where health insurance costs are going and how they're rising, even they're limiting how much an insurance company can make to 15 and 20% because of where the costs are going. That 15 or 20% is going to be more than it was in a couple of years ago. So they're still going to make more money. So one of the things the healthcare reform law did was employers who have more than 50 full-time employees will be fined up to $2,000 if they don't provide insurance starting in 2015. So they're trying to force large employers to offer health insurance. And this was originally, supposed to take place in 2014, and now it's being delayed till 2015. So what was interesting about that is it was originally stated that this was because of, letting employers take more time to learn about the law and to be able to comply with it. But there's also a lot of talk that this was delayed to 2015 because if it was implemented for 2014, January 1st, when it was supposed to be, then what would end up happening is you would have more people very upset in the employer market, and in the employee market because costs are going up, and congressional elections are actually not coming up next fall, and that there would be a chance that a lot of Democrats would get voted out of office. And so there's a whole school of thought that it was delayed to go into effect January 1st, 2015, because people would not feel the impact of the cost until 2015. So therefore, the elections would be able to go forward, and obviously that would make things a lot easier. So, so along with that, the delay is happening in 2015, so that's somewhat positive. I think some people are waiting to see if the individual mandate will be delayed until 2015. But that actually looks like it's going to potentially move forward, and there's no talk about getting rid of the individual mandate. So it's it's very fascinating, and the $2,000 fine is really important because a lot of employers can't afford this $2,000 fine. There's a lot that are in shock that haven't offered health insurance, or they've offered minimal coverage that doesn't qualify under the ACA. So imagine if you're an employer with 20,000 employees, and now you have to pay a $2,000 fine. That's a massive fine that you can't afford. So this is another area of why I think we're going to see more employers implementing medical tourism, because if they have to offer health insurance and they haven't paid for it before because of the fine, then they're going to have to look at ways they're going to have to lower costs. And what we're also seeing is, and a lot of these things is interesting, is I was talking about these things back in 2010, is that employers are, if you go back to the webcast we did back then, that employers would shift full-time employees to part-time, hourly, or 1099 to avoid having to provide them coverage. And that's already starting to happen. We're starting to see a lot of large employers and mid-sized employers starting to cut back the number of hours employees are working so that they don't have to pay them they don't have to provide health insurance. So if we look at some of the major updates on costs, the White House on Wednesday, September 25th, just about a week ago, released a report on the cost of Obamacare for most Americans, heralding its interpretation that 95% of the nation will be able to buy health insurance premiums below earlier projections. So the key word here is earlier projections. So that doesn't mean that when Americans buy insurance, it's going to be cheaper than it was before. What they're saying is their earlier projections were that costs were going up, and that their recent report showed it wasn't going up as much. So there's a lot of marketing and politics around healthcare reform, and very key words being used, which unfortunately, when the public hears it, the average person, it makes them think, oh, this means costs are going down. So no one's really telling people the way it is. So let's look at some actual increases. So, just last week it was reported there was a 27-year-old man from Memphis, Tennessee, that can buy a plan for as low as $41 a month right now. But on the exchange, so you have these health insurance exchanges now called marketplaces, where everyone's supposed to be able to get more affordable coverage, and it's going to be very competitive. But what we're seeing is they're not as competitive, and that there's a lot of health insurance companies that don't want to participate in the exchange because you have to provide certain mandated benefit, and it's not a profitable line of business. So there's less competition, less offerings, and costs aren't as cheap as was expected. So the same person on the state exchange, the lowest state average for his health insurance per month was $119 a month, or a 190% increase. A 27-year-old woman from Nashville could buy a plan for $58 a month, but on the exchange, the lowest price plan was $114 a month, a 97% increase. And so even with a tax subsidy, that plan is $104 a month, twice what you would be paying today. So, it was reported that women in Nashville can choose from 30 insurance plans that cost less than the administration says insurance plans are on the exchange. So outside of the exchange, they can buy plans more affordably than on the exchanges. So what this is telling you is the state health insurance exchanges aren't going to be the solution, or we're going to have to wait a while or a couple years to see how this plays out. But everybody kind of knew this years ago. This isn't new information. So in Nashville, Tennessee, 105 health insurance plans that people had the choice of buying in Tennessee, in Nashville, today won't be available in the exchange, meaning less options, less selection. Now let's go back to the release, this previous slide, on what the administration, the HHS said, is they said that people will be able to buy health insurance premiums below earlier projections. They're not telling anyone your costs are going up. They're trying to make people believe that costs will be more affordable. When we look at this actual information, that it's the reality of the exchange, that's not the reality. So back to someone else from Tennessee. I guess Tennessee is the lucky state where all the examples are happening from. So in Tennessee, they found that it potentially is going to increase men's premiums triple and women's double. So a senator from Tennessee, and obviously he's against healthcare reform, but he said, why should a 27-year-old male in Memphis be forced to pay nearly 3 times more than what he would pay for health insurance today? Or why should a young woman in Nashville pay twice as much? So it's higher cost and less choice. Now, there are going to be some state exchanges where costs are lower, but the majority of the state exchanges across the country are more expensive. We're also seeing some stuff from the insurance companies. So there was a letter from Humana, one of the 5th largest insurance companies in the United States, and this was to an actual individual who had their insurance. It said, if your policy premium increased, this was a renewal letter, you should know that this isn't unique to Humana. Premium increases generally will occur industry-wide. Increases aren't based on your individual claims or changes in health status. Many other factors go into your premium, including the ACA, the Affordable Care Act, also known as Obamacare. Compliance, including the addition of new essential benefits. And the new essential benefits are things that are mandated by the law. So what Humana is telling people is, hey, you noticed your health insurance costs went up, and we wanted to let you know it's because of the healthcare reform law, Obamacare. So let's switch over to Louisville, Kentucky. Insurance tripled in 2014 from $333 a month to $965 a month for Andy and Amy Mangione. And they got a letter from their insurance company, which happened to be Humana again, that said, the same thing. If your policy premium increased, you should know it isn't unique to Humana. It's occurring industry-wide. And that increases aren't based on your individual claims or changes in health status. Many other factors go into your premium, including ACA compliance, including the addition of new essential health benefits. So Forbes, on September 25th, reported that the healthcare reform law, Obamacare, will increase on average the individual marketplace insurance premiums by 99% for men and 62% for women. And it's based on the Manhattan Institute analysis of the HHS numbers. You can go ahead and there's a link here, so you can look at it the most. And they found that the worst off is North Carolina, which will see individual market rates triple for women and quadruple 4 times for men. So when we were talking about earlier about full-time big employers and mid-sized employers trying to shift and get full-time employees who you have to offer health insurance to, if you have over 50 employees, to part-time, then, here's the trend. So there are 313 employers that we know publicly have come out and said, we're lowering employees' hours to get out of this. Some bigger employers, Beals Department Stores, Indiana University, Arkansas State University, Miami-Dade College, and a couple hundred more. So what about the ones that are not publicly known about it? So how does healthcare reform affect inbound medical tourism into the United States? It doesn't affect inbound medical tourism. Most patients coming into the U.S., they're international healthcare consumers and patients. They're either paying by cash or they're covered by a private insurer or a foreign government or some other payer. So they're going to continue to come to the U.S. And as more global health insurance policies are issued around the world in developing and developed worlds, I think we're going to see more international healthcare consumers going to the U.S. But that also is going to depend on how U.S. hospitals get aggressive in marketing themselves international, because they have a lot of competition globally now, as a lot of countries are investing in their healthcare infrastructure, and a lot of modern and amazing hospitals are being built. If the U.S. hospitals do not get aggressive, then they're going to lose their market share of this marketplace, and it won't increase. And that's a challenge for the U.S. market, because a lot of the really specialized hospitals, they're brand names. They've been around for a very long time in the United States. They're known as the best hospital, and they have a lot of history. So they have an attitude that they don't need to market themselves. They don't need to brand themselves. And what I think we're going to see is those big brands are going to lose some of the patients they're getting to new brands, new hospitals in the U.S. that get aggressive and go out to work with the buyers. So inbound medical tourism, we're going to see a continued increased demand, and that market is growing. It's not going to change. How does healthcare reform, Obamacare, affect domestic medical tourism within the U.S.? U.S. employers, insurance companies, incentivizing employees to travel within the U.S. to centers of excellence. It's not going to have any effect except a positive effect. So domestic medical tourism is going to grow because healthcare costs are going up, and employers are going to look, how do I reduce costs? How do I make sure I have better outcomes, better quality, and my employees return to work faster and are more productive? And that's going to be based upon, implementing U.S. centers of excellence, where you're encouraging your employees to go to the best hospitals with the best outcomes for fixed bundled packages. So this is going to be competition in international medical tourism, because you're seeing more an emergence of fixed bundled packages in the U.S. But it's also very positive for outbound medical tourism, because as employers do this, then it's raising that awareness and the acceptance that you can incentivize employees to travel for care. And employers are looking for any kind of creative option to lower costs. In domestic medical tourism, you might be getting more footage, more media coverage of it now, but don't think it's new. I ran a national health administrator, and we were doing this back in the early 2000s. We called it steerage, sending members to specific hospitals within the U.S. Now, also, you have, with healthcare reform, you are going to see costs go up. You are going to see more employers and insurers do it. One of the fifth largest insurers, one of the top health insurance companies in the U.S., they do it. We educated them on healthcare reform. We got them involved within hospitals overseas, and they offer it. They go around and they talk to all their insurance agents and brokers, and they explain it to them and what's offered and how they can do it. So it's being done. Healthcare reform is just going to create momentum where it's going to really keep growing. Now we have our white paper, which is if you email us, you can get a copy of it. I want to go into a couple opportunities outside of talking a little bit about healthcare reform, because our conference this year, which is November 3rd through the 6th, is a really great opportunity if you want to focus on the U.S. marketplace. So we bring in a lot of international buyers from every region of the world. We bring in people from Africa, from Asia, from Europe. We're bringing like 15 in from Russia. But if you want the U.S. market, our conference is integrated with the Employer Healthcare and Benefits Congress. So it's the largest employee benefits and healthcare conference in the country, and it brings in about 1,000 of the top leaders in U.S. health insurance. So we've been educating the U.S. insurance marketplace for 7 years. A lot of them, they understand medical tourism. They know costs aren't going down, and they only have three options to lower costs. It's implement corporate wellness program, which takes a couple of years to do, and you got to do the right program, and it's tough to measure return on investment, or it's implement domestic or international medical tourism. Those are the two options. They don't have a lot of options. And also, we're dealing with an ethnic United States. It's multicultural now. It's no longer just, Caucasians, African Americans. The minorities are going to be the majority. So this means that, research has found like 50 to 60% of people, if you're Hispanic American or Asian American, would leave the country for healthcare if you could get the same quality at the same cost. So the majority of the U.S. is going to be this melting pot of people who are very open to traveling for care. So I think with healthcare reform driving costs up, we're going to see U.S. emerge in the next couple of years as one of the top markets for medical tourism. And there's nothing in the horizon that's going to lower costs. Healthcare reform did not reform medical supply costs, pharmaceutical costs, medical malpractice and lawsuits. And because it didn't do that, it didn't do anything that is going to fundamentally lower costs. And a study by Gallup found that 25% of costs, I think it's something like $6 billion, is from doctors providing defensive medicine, covering their ass, doing medical procedures and tests and surgery that they don't need to protect themselves from liability. So if you don't reform doctors being sued, the cost of pharmaceuticals, the cost of medical supply, all these different things, costs aren't going down. They're going to continue trending, as we showed before. And it's amazing to see, being in this industry, that an asthma inhaler that costs a $25 copay with Blue Cross Blue Shield is $1 in Jordan, or a knee implant that costs $15,000 in the U.S. is $3,000 in India, and it's the same manufacturer. So our conference this year, it should be our biggest yet. It's in Las Vegas. Las Vegas is one of the top destinations for conferences, and the estimated attendance usually goes up about 15 to 20%. We're going to have up to 2,000 attendees from 100 countries, the private networking meetings, but we also have, I think it's in here, but we have a healthcare reform workshop that you can attend on Sunday, which is a several-hour workshop by some leaders in the U.S. health insurance industry. And the whole purpose of the workshop is to teach you how to be an expert in healthcare reform, not an expert, but be educated, and to understand how it affects U.S. companies, U.S. employers, insurance companies, and agents. So as a medical tourism participant, you can understand how you can best fit in that equation and how to have an intelligent conversation with them. And you want to have an intelligent conversation because you want them to partner with you. And you need to understand what does healthcare reform really mean? How does it really work? And how do you implement medical tourism in a U.S. health insurance plan? We work all year to really bring in amazing speakers. We got some great keynotes from Zappos, which is really going to focus on how do you get raving fans from your customers, your healthcare consumers. Dr. Marty Makary, who's the New York Times bestselling author of the book Unaccountable. He's a top doctor in the United States. We have Facebook, the New York Times bestselling author of Change Anything, Understand People's Behavior, Chief Medical Officer of Verizon. And as I was saying before, the conference is integrated, so you get to come, for medical tourism, but you get to also network with people from the U.S. insurance industry involved in self-funding, corporate wellness, voluntary benefits, healthcare reform, and then global benefits, which is multinational employers or insurance companies. There are CMEs available at the conference, continuing medical education credits in partnership with the Medical Tourism Association and the University of Miami. We launched the first CMEs in medical tourism last year, and we've really expanded on them. And you can learn best practices on getting CMEs from dissecting the medical travel process, quality, planning a site visit, contracting with providers, and some other things. And then we also have on Wednesday, November 6th, a certification course you can attend where you can become a certified medical tourism specialist. So as I was saying, the U.S. is turning into a multicultural environment. This year or next year, the majority of babies being born in the U.S. are going to be multicultural and not Caucasian. It's the first time. So it's showing the total changeover of the makeup of who makes up an American citizen. It's now multicultural. And this is exciting for medical tourism because if you're of Colombian descent, you're open to going back to Colombia for healthcare. If you're from Philippines descent, you're open to go back to the Philippines. You probably have family there. There's no issue with the culture, with the language, with safety. So, it's kind of exciting, and we're really excited for, the Nightline and Diane Sawyer, because I feel like this is going to really be a game changer. So with that, we're going to open this for questions for anyone who might have any questions. And also, as I said before, the webcast is going to be available online afterwards, so you can ask any questions that you would like. And now, or you could email me or call me later. So one question is, is it possible to get a copy of the PowerPoint? It will be emailed out to everyone before, maybe in a day or two. One question was, is the fine a one-time penalty, or is it for a given year? This is from Joy. So the fine for the individual mandate, if you're an individual and don't buy health insurance, that fine is on a monthly basis. Now, for employers, the $2,000 fine, if you're not offering coverage and you have more than 50 full-time employees, that is a yearly fine. It is not just a one-time penalty. So every year you're paying $2,000. So that is going to force employers to look at, I need to be super aggressive and super creative in order to lower my healthcare costs. Another question from Jim is, won't people be able to buy insurance by going to insurance companies as before? You just don't get the subsidy if not on the exchange. But yes, people will go to the health insurance companies to buy health insurance. So you can get subsidies on the exchange. So, the exchanges are just a different avenue to buy insurance. But otherwise you can just go to health insurance companies and do it. But what's very interesting is some health insurance companies are telling people go to exchanges. So I actually have an employee who came to me today, and their spouse got a letter in the mail from one of the big insurance companies, and their health insurance is on bank draft. It's automatically debited from their bank account every month. So it showed that it went through for 2 months, but for some reason the insurance company didn't get it, and the coverage lapsed over 2 months. So the insurance company sent a letter and said, hey, we didn't get your payment for 2 months. We canceled your insurance and go buy insurance in the exchange. So it's really kind of like very interesting. Some insurers saying to go buy it in the exchange versus buying it direct. It's going to be really interesting to see how it actually plays out. Another question is, have other employers incorporated medical tourism in their healthcare policies? And other than the company showcased on the Nightline special? Yes, absolutely. When I was running my national TPA healthcare administrator back in the early 2000s, I was the first person in the U.S. to implement self-funding in the medical tourism program. So kind of what I was doing at my company over a couple-year period, we were constantly in the news and the media, Time Magazine, Wall Street Journal, New York Times, is what our company was doing is what got others to get active in this industry to start, whether it's facilitators or hospitals trying to come into this marketplace. So this has been going on for a very long time. It's just no one has been out publicly saying, hey, I do this. No one wanted to be that first company that does it. So will high deductible policies still be offered? This is from Terry. Yes, there are limits on it of out-of-pocket expenses and deductibles that employees have to pay, and they actually just delayed that a year. It was supposed to go into effect where there was a cap starting January 1st of 2014, but they pushed it off to 2015. So there are going to be caps on the high deductible plans, but they still will be available. So that is all the time I have for today's presentation because we're kind of running out of time. So if anyone has any other questions, please feel free to email me. Look forward to seeing you at the conference. We're going to be doing a lot of education also to the U.S. employer and insurance marketplace over the story that was just out on Nightline. So we just sent out an email to almost 500,000 employers and insurance agents around the country yesterday, basically sharing that story and saying, come, learn more about this. So we're working very closely on the Employer Healthcare Congress, which is integrated with the Medical Tourism Congress this year, to create a very big buzz on international medical tourism. And we're going to be playing that video and making people very aware of it at the conference. so that I think it'll create a new air of openness and interest from the U.S. marketplace. So with that, I would really like to thank everyone for coming. Dan Benzel will get this all whipped out and hopefully out to you guys in the next 24 to 48 hours. And for those of you that are going to be in Vegas in a couple weeks, I look forward to seeing you. Make sure, if you haven't booked your hotel room, make sure you book it. Usually, our room block at the hotel fills out about 2 to 3 weeks beforehand. But this year, it sold out a month and a half beforehand because we have increased participation and registration. So, you can get a room at the Caesars, or there's also the Flamingo, which is just across the street, which also has affordable rates. So hope to see you all there, and take care and have a great week.